Welcome to the Path and Lab section. Let's get started. CLIA waiver. The Clinical Laboratory Improvement Amendments, CLIA, regulate laboratory testing and require clinical laboratories to be certified by their state as well as the Centers of Medicare and Medicaid Services, CMS, before they can accept human samples for diagnostic testing. Waived tests include test systems cleared by the FDA for home use and those tests approved for waiver under the CLIA criteria. Antigen is a term you need to know. An antigen is a substance that causes your immune system to produce antibodies against it. This means your immune system does not recognize the substance and is trying to fight it off. TSH, this stands for thyroid stimulating hormone. CBC, this stands for complete blood count. Here are some modifiers for this section. QW is for CLIA waived tests. This is used for Medicare claims. 32 modifier is for mandated services. The 90 modifier is for outside lab. 91 modifier is for a repeat lab test on the same date. And you need to note that you will not use the 26 modifier with lab codes. The 32 mandated services is for any lab tests that are mandated for the patient to take, such as court ordered. Now let's talk about drug testing. Again, an assay is to determine the content or quality of the drug. You need to know the term qualitative, which is what is present, and quantitative, which is how much of it is present. For example, alcohol. Is there any alcohol in the blood? That's qualitative. The measure of the blood alcohol level is quantitative. Now let's talk about presumptive screening and definitive screening. This is the table of contents in your Path and Lab section. As you can see, we're talking about drug assays, 80305 through 80377. There's a lot of guidelines on drug testing that you should review. Let's review some of the key parts together. As you can see, 80305 is drug test presumptive, any number of drug classes. What does presumptive mean? Drugs or classes of drugs may be commonly assayed first by a presumptive screening method, followed by a definitive drug identification method. For example, if someone overdosed or passed out, they're going to do a presumptive test to see if there's something there. But if there is, they're going to do a definitive test to see how much of it is there. The methodology is considered when coding presumptive procedures. Each code, 80305, 80306, and 80307, represents all drugs and drug classes performed by the respective methodology per date of service. Each code also includes all sample validation procedures performed. Examples of sample validation procedures may include, but are not limited to, pH, specific gravity, and nitrate. The codes 80305 through 80307 represent three method categories. 1. Code 80305 is used to report procedures in which the results are read by direct optical observation, so by the eye. The results are visually read. Examples of these procedures are dipsticks, cups, cards, and cartridges. You could write that next to 80305. Code 80306 is used to report procedures when an instrument is used to assist in determining the results of a direct optical observation methodology. Examples of these procedures are dipsticks, cards, and cartridges inserted into an instrument that determines the final result of an optical observation. Report 80306 once, irrespective of the number of drug class procedures or results on any date of service. Code 80307 is used to report any number of devices or procedures by instrumented chemistry analyzers. There are many different instrumented methodologies available to perform presumptive drug assays. Examples include immunoassay, chromatography, and mass spectrometry, either with or without chromatography. Some of these methodologies may be used for definitive drug testing also, but for the purpose of presumptive drug testing, the presumptive method is insufficient to provide definitive drug identification. Report 80307 once, irrespective of the number of drug class procedures or results on any date of service. Now let's talk about definitive drug classes. The definitive drug class listings page provides the drug class, their associated CPT code, and the drug included in that class. For example, if you want to know what is in the class for alcohols 80320, you would go over to the table that looks like this and go to the code, and you can see all of the drugs tested for alcohols. It's important to know that because the question might not say alcohols, it might say one of the listed drugs underneath alcohols, so you would need to come to this table to see what type of class it is. Now let's talk about panels. This code range is 80047 through 80076. Think of panels as combination codes. Often, physicians will order a certain group of tests to determine whether a patient has a certain illness or to rule one out. The group of tests are called a panel. CPT has grouped tests that are ordinarily or commonly done together. These are called a group panel. This makes it easier for physicians who coincidentally don't need a list of every test they are ordering for a specific patient. This doesn't mean that physicians have to order their lab work this way. The panels are designed to make it easier for them, but are not intended to tell them how to practice medicine. The individual tests make up the panel are listed in their individual code so that you know exactly what tests are represented by the panel. If one of the tests listed for a specific panel is not ordered, you cannot use that panel code. All the listed tests must be performed to use the panel code. The other thing that can happen is that in addition to everything listed in the panel code, the physician may order one or two additional tests. In this case, the coder uses the panel code and then lists the code for each additional test not included in the panel. Let's look at an example of this. This is my panel page in my CPT book. I bracketed each panel and put the number of tests in that panel. Let's look at an example of 80047. 80047 is the basic metabolic panel, calcium ionized. This panel must include the following: calcium ionized 82330, carbon dioxide 82374, chloride 82435, creatinine 82565, glucose 82947, potassium 84132, sodium 84295, and urea nitrogen 84520. You must have all of those to use this code. Even if you have all of them, but maybe not one, such as sodium, you cannot use this code and you must do each individual code when coding. You would code all of the codes in parentheses except for the sodium code. Now I do want to mention that some panels mention other panels. For example, the general health panel. This is a panel that includes another panel. This panel must include the comprehensive metabolic panel, which is down here, so it must include all of these, plus it must include a CBC differential WBC count. Now I want you to try. What would you code for carbon dioxide, chloride, and sodium? Because potassium was not performed in that scenario, you do not code the panel code, but instead you would code 82374, 82435, and 84295. Look at panel code 80051. That would have been the appropriate code had potassium been performed. Now turn to the therapeutic drug assays. Therapeutic drug assays are quantitative. The list is a list of drugs that are being given for a therapeutic purpose. However, since levels of them could become toxic to a patient, they are closely monitored. For example, lithium is a drug that is used to treat patients, but if there is a high level of it in the blood, it is toxic to the patient. So physicians carefully monitor this. Sometimes after a heart attack, a patient is prescribed Coumadin to take daily. As a result, the patient has to go in periodically to have levels checked in their blood. If they get too high, the patient could actually bleed to death from just a simple little cut. Levels can also be too low and not provide the desired therapeutic result. Now turn to consultations. These are codes 80500 or 80502. The difference in these consultations is that the patient is not present. A clinical pathology consultation guideline we read is a service including a written report rendered by the pathologist in response to requests from the attending physician in relation to a test result requiring additional medical interpretive judgment. Reporting of the test results without medical interpretive judgment is not considered a clinical pathology consultation. The key here is that there must be a written report. The clinical pathologist is being asked to review a lab test, a lab specimen, or a tissue sample, whatever the situation might be, and render his clinical judgment in a written report. Again, the patient is not present. This is strictly a clinical review of information or a tissue sample. The next section is urinalysis. You should read carefully through these codes and choose the correct code for the analysis that you're performing or the level of testing that you're doing. Urinalysis is commonly performed in a provider's office as a CLIA waived test. QW modifier for Medicare patients would be appended here. 81000 is a urinalysis by dipstick for bilirubin, glucose, hemoglobin, ketones, leukocytes, nitrate, pH, protein, specific gravity, urobilinogen, and any number of constants. Non-automated with microscopy. 81001 is automated with microscopy. 81002 is non-automated without microscopy, and 81003 is automated without microscopy. If a dipstick is used, look at code range 81000 through 81003. I bracketed these in my book and put dipstick. Turn to the molecular pathology section. The molecular pathology section lists procedures involving the analysis of genes. This exciting and developing area of medical testing promises clues to illness and possible future treatments. Code selection is typically based on the specific gene or genes being analyzed. The molecular pathology codes include all analytical services performed in the test. This section contains useful definitions at the beginning of the section, such as gene, mutations, and other very useful terms are defined and should be reviewed. Tier 1 molecular pathology is the first section. Tier 1 molecular pathology procedures are gene-specific, representing genomic procedures. This includes genetic tests for breast cancer, which is BRCA1 and BRCA2, and for cystic fibrosis, among others. Tier 2 molecular pathology procedures report codes for procedures not listed in Tier 1 molecular pathology. These codes represent medically useful procedures generally performed less commonly than Tier 1. These codes are very specific and are listed by level ranging from 1 to level 9. Turn to your table of contents and find the hematology and coagulation page in your book and turn to it. You will want to highlight the parenthetical references at the start of this category to easily recognize what codes are found here. Hematology and coagulation tests are performed specifically to test blood clotting. How fast is the patient's blood clotting? This subsection also looks at various types of blood tests that can be performed, such as a CBC, which is a complete blood count, and a white blood count, WBC, which can check for blood disorders such as anemia. Now let's talk about immunology. The guidelines say the following codes are qualitative and semi-qualitative immunoassays that are performed by multiple step methods for the detection of antibodies to infectious agents. For immunoassays by single-step method, use code 86318. Procedures for the identification of antibodies should be coded as precisely as possible. For example, an antibody to a virus could be coded with increasing specificity for virus, family, genus, species, or type. In some cases, further precision may be added to codes by specifying the class of immunoglobulin being detected. When multiple tests are done to detect antibodies to organisms classified more precisely than the specificity allowed by available codes, it is appropriate to code each as a separate service. For example, a test for antibody to an enterovirus is coded with 86658. Coxsackie virus are enteroviruses, but there are no codes for the individual species of enterovirus. If assays are performed for antibodies to Coxsackie A and B species, each assay should be separately coded. Similarly, if multiple assays are performed for antibodies of different immunoglobulin classes, each assay should be coded separately. When a coding option exists for reporting IgM-specific antibodies, the corresponding nonspecific code may be reported for performance of either an antibody analysis not specific for a particular immunoglobulin class or for an IgG analysis. The guidelines are very specific in telling you how to use these codes. So you want to take your time and be very familiar with the guidelines and then look at the codes they apply to and make sure you understand how to code them correctly. Microbiology is the study of bacteria. So if we read the guidelines under microbiology, it tells us that this section includes bacteriology, mycology, parasitology, and virology. In other words, it's the study of bacteria, fungi, parasites, and viruses. The next paragraph of the guideline says presumptive identification of microorganisms is defined as identification by colony morphology, growth on selection media, gram stains, or up to 3 tests. Definitive identification of microorganisms is defined as the identification to the genus or species level that requires additional tests. For example, cultures. How many times have you gone to the physician office and they have taken a urine specimen and then told you they would call you back in a couple of days because they need to see if something grows out? That would be a culture of the urine to see if any organisms grow. The guidelines go on to say that if additional studies involve molecular probes, nucleic acid sequencing, chromatography, or immunological techniques, these should be separately coded, in addition to definitive identification codes. For repeat laboratory tests performed on the same day, use modifier 91. Also use modifier 59 if you are going to be testing multiple specimens or doing multiple cultures on the specimen. These are tests that are specifically looking for bacteria or parasites on the cultures. They can be specific to the type of specimen that is submitted or to the type of microorganisms they are looking for. Moving through the sections of the CPT book, we come to anatomic pathology and post-mortem exams, or what we know more commonly as autopsy or necropsy. They are divided into 4 different categories. The first is gross exam only of the body and additional situations listed below. Progressing to the next category, the organs are also examined by making slides and using the microscope. The third category is a limited autopsy of a region or single organ. Perhaps the patient died of a heart attack and they want to examine just that organ. A forensic exam is done in the case of a homicide victim to gather evidence to present to the court of law. A coroner is called if there is a death from unnatural causes. And in some cases, when the patient does not have an attending physician, the coroner signs the death certificate. Cytopathology is next. Cytopathology is the study of disease changes within individual cell or cell types. Cells can be obtained by several methods, such as by washing or brushing a surface, and are then studied on a slide under a microscope. Cells also can be collected with a fine needle aspiration of fluid. The last subsection we're going to be looking at in the Path and Lab section of the CPT book is surgical pathology. A specimen is a tissue sample that is submitted for separate examination and pathologic diagnosis. Each specimen that is to be evaluated has to be identified separately. Sometimes several specimens are obtained during a procedure and sent to pathology in separate containers. Other times they may all be placed in one container. If they are all in one container, then that is considered one specimen. Unless each specimen is in its own container, it cannot be separately identified. To do this, the physician will use ink or suture to label and identify each one separately. These codes are divided into levels 1 through 6, and each level contains a different level of specimen or level of diseased tissue. When surgery is performed and a tissue is removed, or an organ is removed, or when the biopsy is performed and a lesion is excised, or a piece of tissue is excised and sent for pathology studies, this is the section of the CPT you're going to code from for the Path and Lab services. You use one of these codes for each specimen that you receive. If you receive multiple cysts, then you use the appropriate code for each cyst received as a specimen. When a specimen is sent to pathology or sent to the pathologist, it is inspected. The first level, or level 1, is doing the gross exam only. The pathologist picks up the specimen and looks at it with his or her eyes and thinks, oh, yes, this is a liver, or yes, this is an eyeball, or that is an amputated finger. All they are doing is looking at it with manual vision, and that's considered a gross examination. When you move into the next level, level 2, the physician is doing not just a gross exam, but is also looking at tissue, blood, cells, or other specimens with a microscope. Let's take a look. These codes are listed by the type of sample identified, and each level moves up in severity or complexity. To try to illustrate this and make it a little bit easier, let's look at the word skin. Skin in level 2 is just from a plastic repair. So what they have received in the pathology lab is some skin tissue that was removed strictly for plastic repair. Maybe it's part of a facelift. The surgeon has sent the tissue to make sure that there is nothing to be concerned about. There's no skin cancer or anything else abnormal growing. The surgeon is making sure that the sample is healthy skin. The skin from the plastic repair is coded with level 2 pathology. If we look for the word skin in level 3, we come to skin, cyst, tag, or debridement. So the sample might be a cyst that was removed and sent to pathology, or a skin tag that was removed and sent to pathology, or perhaps it was skin tissue that has been cut away or debrided from a wound, an ulcer, or something else that the sample has been sent to pathology for study. When we look at the word skin under level 4, we find that here skin is described as other than cyst, tag, debridement, or plastic repair. So if skin is sent to pathology and it's not a cyst, tag, debridement, or plastic repair, and it's from some other source, that specimen is coded in level 4. Perhaps it is a lesion that was on the skin or some other type of specimen and sent to be examined. Depending on the type of skin tissue being examined or the severity of the disease of the tissue, the code is going to move up or down in the levels. In addition, in this section, there are pathology consultation codes where the opinion of the pathologist is requested by the physician. In the first type of consultation, the pathologist is reviewing slides that have already been prepared and possibly already reported on by another pathologist. In the second consult, the pathologist is sent a sample, a slide is prepared, and analysis performed. The third type of consult includes the specimen analysis as well as a review of the patient's medical records. Sometimes during a surgical procedure, a pathologist will be asked to review the tissue while the patient is still in surgery so that the surgeon can determine if he needs to proceed with a procedure. For instance, if a patient has a lump removed from her breast, The surgeon may want to wait for confirmation that it is benign or malignant. If the frozen section indicates the tissue is malignant, the surgeon may continue with a mastectomy or lumpectomy. If the specimen appears benign, the biopsy may be all that is performed. The end. This is a long section, and make sure to study and practice and take your exam.